everyone. Thanks for coming. I think we're going to get started now. So, today's class is on the skeletal system. What is the skeletal system? Basically, what the skeletal system is, it's the framework of the body, and it consists of your bones and the other connective tissues that are attached to your bones, and it basically protects and supports all your body tissues and your internal organs. And there's five main components of the skeletal system. There's bones, and then you've got your ligaments, tendons, and cartilage, which are kind of like the connective tissues from like bones and stuff. And we have your joints. So today's aims are as follows. First, we're going to discuss the bones and the different types of bones, and then we're going to discuss joints. The other things I mentioned in the components of the skeletal system, like the ligaments, tendons, and cartilage, I'll be discussing them with the joints. So I kind of combined everything to make it more simple. All right, first up, we got bones. So osteology is the study of bone structure and the treatment of bone disorders. So it's kind of everything in the bone scientific field morphed together, and that's osteology. So bone tissue is actually very unique. You won't find it, anywhere else in the body. And it consists of matrix, which we discussed, I think, 2 classes ago, and that's the intercellular substance surrounding widely separated cells. So bone tissue, the cells are very separated. They're not close together. They're very far apart, and what connects all of these cells together is the matrix. And bone matrix is very unique. It's 25% water, 25% protein, fiber, or collagen, and 50% mineral salts like calcium or phosphorus, and bone cells, which are called osteocytes. And what makes bone tissue, like so firm, so hard, is kind of due to the protein, fiber, and the collagen, and it's also kind of due to the bone cells. Like it's a very hard substance. You won't find a hard matrix kind of anywhere else in the body. Usually it's liquid, but bone matrix is very solid. All right, I mentioned that bone is very special, and here are 2 special characteristics. One is hardness. This is provided by the calcification of mineral salts. And calcification is when mineral salts such as calcium phosphate and calcium carbonate, it crystallizes around the collagen fibers in the matrix, which hardens everything together. As I mentioned before, you won't find that anywhere else in the body. It's only specific to the bone. And the other thing you'll find special is tensile strength. And that's when the collagen fibers, reinforce the matrix, and it makes the bone actually pretty flexible, which is strange. It can like bear a lot of weight. That's kind of tensile strength. And even though bones can break, it's kind of not very easy to, if you've ever broken a bone, you have to put extremely like immense amount of force on it for it to break, and it's very, very painful. So yeah. All right, so there's 4 main types of cells in bone tissue. The first one is called osteoprogenitor cells, and these are unspecialized precursor cells that form osteoblasts by mitosis. So they're kind of like the most basic bone cells. They're like if you think of it, they're like the baby bone cells, like they're unspecialized. They don't really have like a job yet. They don't have a thing, they don't have a function yet, but they're going to develop into, more mature cells with a special function to help your body. But these are kind of like the babies of bone cells. Then second, we have osteoblasts, which are immature bone cells that form bone. So they're like a step up from the osteoprogenitor cells, but they're still not quite, mature. They secrete collagen and organic compounds that build bone tissue matrix. So it kind of forms bone, it kind of builds up the matrix. And yeah, if you ever break a bone, the osteoblasts are going to, help you grow new bone cells around the fracture. Then we have osteocytes, and osteocytes are a step up, so they're mature bone cells. And these maintain daily cell activities of the bone tissue, so it kind of, makes sure it gets like all the nutrients and like things like blood supply, make sure it's like functioning, everything's functioning properly. And lastly, we have osteoclasts, which develop from white blood cells actually. And these are very important for, development, growth, maintenance, and the repair of bone. So it's really important. Like when you're growing, when you're going through puberty, your osteoclasts are going to help your bones grow and for you to get taller. There's also 5 types of bone. So first we've got long bones, and these characteristic of this one is they consist of a shaft with greater length than width. So it's going to be more long than wide. So it's a very, well, it's kind of in the name, long bone. And yeah, it's kind of like as you see in the picture, you can find a long bone looks like this, kind of the stereotypical bone. I don't know. I feel like when you see a bone on TV, it kind of always looks like this. An example of a long bone in your body is your femur. So as you see, the femur is very long. It's very thin. This is the shaft. I mean, what I mean by shaft is that it's like longer. This is kind of the bone shaft. It's longer than it is wide. Then we have short bones, and short bones are cube shaped, and they have equal length and width. So if you think of a cube, all sides are equal. They have the same sides, and yeah, you can kind of find these in your kind of like your foot right here, your short bones. Special bones in your foot are actually cube shaped. They're very small. As you can see, it's in the foot. Then we have flat bones, and these are thin, and they're composed of 2 parallel plates. So here's a flat bone. An example is your sternum. So this is an example of a flat bone up here. As you can see, it looks very thin, kind of small, kind of lays flat, and it has 2 parallel plates kind of fused together. Then we have irregular bones, and these are the ones that are complex shapes. It's kind of in the name, they're irregularly shaped, and that would be something in your like your spinal cord, like your vertebrae in your spinal cord. As you can see here, like they're very, you can't really describe it. Like it's not like a circle, it's not a rectangle, it's not like a cube shape. Like you can't really describe the shape very well because there's just so many, bumps and grooves and all that. So that's why we call them irregular bones. And then we have sesamoid bones, and these are found at your joints, and they kind of free float with your tendons. And tendons we'll discuss this later, but tendons are they kind of connect your bones together with muscle tissue. Sesamoid bones, an example is your patella, which is your kneecap that goes right on your knee. Your knee is actually a joint, where you can bend it. So sesamoid bones are always found at joints. Another example is your elbow, and they kind of free float with tendons. So right under the patella, there is a tendon connecting everything together. And yeah, those are the 5 types of bone. And there's also 2 types of bone tissue. So you can really classify bones because there's so many different kinds. First we have spongy, which is also called cancellous bone. Either term is fine. These are located kind of like in long bones. They make up tissue in short, flat, irregularly shaped bones, and they're in the epiphysis of long bone. We'll discuss what the epiphysis is later on. And so they're kind of like abundant. They're kind of found everywhere in every kind of bone. And their function is to store your red bone marrow and provide some support. Your bones, support you. They give you posture. They give you, structure in your body. And if you don't know what bone marrow is, it's kind of like that. It's like the most innermost kind of thing in your bone. And it's really important for it kind of has like red blood cells and stuff. And if you ever hear someone with like leukemia and they say they need a bone marrow transplant, it's to rejuvenate kind of the red blood cells and like the overall blood flow. It's really important. And the structure of spongy bone, it's kind of like it's made of trabeculae, which is basically irregular lattice work of thin columns of bone. So it's kind of just like, if you can imagine, it's like irregularly shaped. It's like spider webs of thin bone. And that's what it basically looks like. And then we have compact, dense bone, and you can call it compact bone or dense bone, kind of the same thing. These are found in external layers of all bones, so they're kind of like the lining, the outside of all bones, and they make up the diaphysis of long bone. And the function of compact bone is to provide protection because they're found on the outside, the external layers, and it also provides support as well, and it helps long bone resist stress of weight. You know, when you stand up, especially, you're putting a lot of weight on your legs and your feet, and it kind of helps the compact bone since it's very like tough. It kind of helps resist that stress of weight. If it didn't exist, then you would kind of just your legs would just collapse, like your bones would not hold you up. And the structure of this is it's made out of concentric rings called osteons. And as we discussed, osteons are basically bone cells. So, you know, bone cells are very tough, and that's why compact, dense bone is just so much more hard, you know? And I kind of think of it as like, you know, spongy bone. It's kind of in the name, you know, spongy. You kind of think it's like, oh, it's not that firm. It's kind of like there to, you know, provide some support, you know, store red bone marrow, but like the compact bone, you know, the really dense one is to provide protection because it's so firm and it's made out of bone cells. So here are just some pictures to help you kind of see everything better. Uh, as you can see, the spongy bone is actually in the inside of the bone, and it kind of looks like this. You can just tell it kind of looks spongy, like more soft. Like it's not like completely soft, of course, but you can see it looks a lot softer than the compact one, which is kind of down below. It's the outside layer of your bones. So that's what gives it like the whitish, you know, color. You can see it's very hard, rigid, um, yeah, and spongy bones always kind of be on the inside of the bone. And here's another picture. Spongy bone is located at, you know, near the ends, the tops of bones. This is kind of looks like on the inside, as I said, like the kind of irregular lattice work, like the spider webs of thin bone, kind of looks like that. And here's a kind of cross section of it, of a compact bone and spongy. So they're always located together. It's just like, think of it as like the compact bone is on the inside and the compact bone like wraps around it like a blanket or like a external protective cover. So let's move on to the structure of long bone. And if you recall, long bone is the one you find in your femur. They're the really long, kind of skinny ones, I would say. So first we have the is the central shaft. So the diaphysis is this like whole, it's from like, it's the whole like central part. So it goes from here and then all the way to here. It's like, it makes up most of the long bone. It's kind of the central part. Then we have the epiphysis, which is the end of long bones. So basically you have the diaphysis, which is the central shaft, and then these two like kind of like grooves, like these little bumpy parts at the top and bottom, they're the epiphysis, they're the ends of them. And these actually connects to other bones. As you can see, this round shape actually connects in a ball and socket joint, which we'll get to later. And this probably attaches to your foot, like the top of your foot, and those are also joints. And then we have the metaphysis, which is the region between where the diaphysis joins the epiphysis. So if this is the epiphysis and that's the diaphysis, then it's kind of like somewhere here and here. It's just kind of between. And then we have the articular cartilage, and this is a thin layer of hyaline cartilage that covers the ends of bone. So it's kind of like I said, like, you know, the compact bone is super hard, you know, and it's like a protective layer. The articular cartilage is like a extra layer of protection. It's kind of like, as you can see labeled here, articular cartilage at the very end of bones. As you can see, it provides like kind of a really thin extra layer, and this is usually for also connecting to joints or like other bones and body parts, makes it easier. Then we have the periosteum, which is a thick double layered membrane, and it's kind of right here, kind of covers the compact bone. It kind of covers the whole bone. So there's two layers to it because it's a double layer. It's really thick. And there's the outer fibrous layer and the inner elastic layer. So the outside is kind of tough, fibrous, durable. And then there's a more inner kind of like elastic, means like stretchy, so like less resistant, less durable layer. And the function of the periosteum is to help bone to grow. It protects the bone, repairs, nourishes, serves as an attachment for ligaments and tendons. It has a very important role. And then we have the medullary cavity, which is the central cavity, and it contains your yellow marrow, which is kind of like a fatty substance inside of your bone. So if you can see yellow bone marrow labeled here, is the yellow stuff here. And that's also the medullary cavity. The marrow cavity is the same thing as the medullary cavity. So it kind of goes all the way down this channel in the bone, all the way down. And then we have the endosteum, which is a thin membrane lining the medullary cavity. So if the yellow thing is the medullary cavity, the endosteum kind of covers it as like protection. There's a lot of membranes, a lot of layers to the bone, but it's kind of for protection and all serves a purpose. So next we're going to go over bone formation. So ossification is the process of bone formation, and it's where it kind of starts when you're just an embryo in your mom's uterus. It's when your embryonic connective tissue, which is also kind of your hyaline cartilage, it hardens the bone, and it kind of begins around the 6th week in utero, so pretty early on, and it could and you hold on. Have your bones are always hardening. It's always developing. Your bones don't actually form, like babies when they're born. They're very soft. You have to be super careful with them because they're so fragile, especially with their head. It's really soft. You obviously can't drop them on their head, but they're very fragile, and that's because their bones are still soft. They're not completely hardened yet, and in utero it doesn't harden completely. Just remember that. And there's actually two patterns of ossification, so two patterns of bone formation. There's something called intramembranous ossification, and it occurs within your fibrous connective tissue, and it occurs in flat bones of your skull and your lower jaw, and osteoprogenitor cells, which I said before are like kind of the baby cells. These develop into osteoblasts, which secrete bony material. And if you recall, osteoblasts are the ones that form your bone. So this kind of ossification occurs mostly in like flat bones in your face, and it's when you kind of like just grow bone, And then we have endochondral ossification, which occurs within hyaline cartilage tissue. And these occur in most bones. So most bones is kind of like long bones. And your cartilage actually becomes calcified from inside out. So if your cartilage is on the inside, it actually starts calcifying, and then it goes from inner to outer. And the hyaline cartilage remains on your articular surface. So the difference between these, I usually remember as, just remember intramembranous ossification is kind of in flat bones, and endochondral ossification is kind of occurs inside out and within mostly long bones. So how bone replacement works is, so basically remodeling is the term for like the replacement of old, worn, or injured bone tissue. So the osteoclast, as we discussed before, removes collagen and minerals, and the osteoblast secretes new collagen and materials and kind of nourishes everything. So osteoclasts, they remove all the old, kind of worn, injured stuff, and the osteoblasts, they bring new rejuvenated minerals to, fix, heal the bone. And normal bone growth requirements, so the usual things you need your bones to grow properly, are minerals such as calcium, phosphorus, or magnesium, vitamins A, B12, C, and D, and hormones, both growth and sex hormones, insulin and thyroxine. So basically, use kind of like, I know maybe a lot of you, I know I do, eat vitamins every day, and it has a bunch of these minerals and vitamins. It's because, your bone needs these things to grow. Like if you don't have them, if you're like severely malnourished in like these minerals and vitamins, then your bones likely like won't grow, or they'll be like super unhealthy. They might, you know, they become really brittle. They might break more easily. That's why doctors say to have a lot of calcium, because calcium builds your bones, like milk, yogurt, all of that. And just make sure to have these, to ingest these, because they're very important to your bones and really important to keep them healthy. So this picture I have here is the bone remodeling cycle. And you can see here kind of just this is like the resting bone surface. The osteoclasts kind of remove all the collagens and minerals of the old bone cell. You can see like the divot here is the injury or the kind of worn out tissue. And then the osteoblasts kind of come, and you see kind of like secrete new collagen and minerals, and they kind of just kind of fill the gap here. And as you can see in the final one, it becomes hardened. That's mineralization, and it's just kind of all brand as new, good as new. Relationship between exercise and your bone tissue. So bone strength varies depending on a lot of factors such as mechanical stress, which is, how much pressure or work you're exerting on your bones. Increasing mineral deposition, which is, how many minerals are kind of deposited on your bones, and the production of collagen fibers. So mechanical stress is mainly affected by, muscle work and gravity. So, if you work out, you're putting a lot of mechanical stress on your bones because you're using a lot of muscle to, lift something. And removal of like mechanical stress, it actually weakens your bone and reduces density. So that's why so many people work out. It keeps your bones healthy and very, you want your bones to be strong. You want bone strength, but removal of this mechanical stress, it weakens your bone and reduces the density of it. And, exercises such as walking and weightlifting increase your bone density, which is really good for your overall skeletal system. So make sure to at least get, 30 minutes of exercise, or if you don't like weightlifting, just kind of just move around. Even that can make a huge difference. So aging and bone tissue also have a very high correlation. So demineralization is the loss of calcium and other minerals from your matrix. So, if you lose all these minerals from your matrix, there's no calcification of the minerals. So that means your bones kind of go soft. They aren't very hard and like firm, and they don't have the strength that you want them to have. And in females, this actually begins at age 30, so very, very young, unfortunately. And it accelerates greatly at around 45 as your estrogen levels, like your hormone levels, decrease because of menopause. And males, it doesn't begin until age 60. So the males are pretty lucky in this department. And decrease in protein synthesis. So if your body isn't, taking in and synthesizing as much protein, it reduces your collagen production. And as you recall, collagen is a big thing in your bone matrix. It's what makes it kind of really firm, yet kind of elastic. And decrease in protein synthesis results in your bone losing tensile strength, and it becomes more brittle. And the reason why the bone is like low key kind of elastic, it's kind of like stretchy. I want to say it's like stretchy, like slime, like it kind of has a bit of flexibility. But when it kind of loses this flexibility, it loses its tensile strength, it becomes really brittle. And brittle, that's bad. Like it's like if your bones are brittle, they break really easily. So people with brittle bones, they suffer more injuries to the bones, more breaks, more overall problems with their bones. And all this comes with aging. So the older you get, the more brittle your bones get. It's nothing. Even if you do exercise every day, you can't prevent this from happening to you. It's just kind of human nature. And these are some disorders of the skeletal system. So osteoporosis is a loss of too much calcium, making the bone less dense. And if there's no calcium, there's no calcification. So it makes the bone less dense and less firm. And then we have rickets, which means the bones are actually too flexible. So they're kind of like more bendy in a way, more flexible. And this is due to a vitamin D deficiency. It can be it can't be cured, but it can be treated. And we have Paget's disease, which is the abnormal acceleration of the remodeling process. And if you recall, remodeling is the replacement of old, worn, or injured bone tissue. So Paget's disease is actually when it's too fast. It's abnormal. It's really fast. And this is actually bad because when it's too fast, it doesn't cause everything to, uh, like mend together properly. So your bones can become kind of permanently not very good. Next, we're going to move on to joints. So joint is a point of contact between bones. And I like to think of joints kind of as wherever you can like move. You have a joint between your arms and your shoulder, obviously, and then a joint between your knee and your shin. There's joints everywhere. It's very vague, the definition. It's a point of contact between bones. You have joints all over your body. And arthrology is the study of these joints, and kinesiology is the study of motion of the human body. So kind of how your body moves and how it can rotate and just function. So there's three structural classification of joints. First, there's the fibrous joint. These are bones that are held really firmly together by fibrous connective tissue, and it permits no movement at all. So you can't move these joints at all. And there's no synovial cavity, which is basically a cavity where it provides movement. So if there's a joint in a synovial cavity, that usually means that you can move it freely. And an example of these is like skull sutures. So you actually have joints in your skulls. You can't move them, obviously, in your tooth socket. You can't really move your teeth either. And then we have a cartilaginous joint, which are bones held together by cartilage. And these permit partial movement, but like not really. Like you can move it a little bit, but like honestly, you're very limited. There's also no synovial cavity. And an example of this is your pubic symphysis, which is basically your pelvis, and your intervertebral disc, which is your kind of spine. Like you can move your spine a little bit, I think, but like honestly, you're very limited in mobility. And then third, we have synovial joint. And these are bones united by surrounding articular capsule. And I'll explain that in the next few slides. And these have flexibility and they allow a free range of movement. So, and these have they have a synovial cavity. So example is your knee or your shoulder, you can rotate them freely. You can move them kind of however you please. And that's how you, get around and go about your everyday life. So this is a synovial joint. It looks like this on the side here. And synovial fluid is kind of the synovial membrane secretions that lubricates and nourishes the joint. So it kind of provides, um, like secretions to help it prosper and grow and keep it healthy. Also, it's still like, lubricate it, which means that so like your joints can like move more freely. So if there's no synovial fluid, it would be kind of hard to move your joints because when you add it makes it less like the point of contact less like if you think about it, if you like put two bricks together, they're gonna be like gratings together. It's not gonna be a very pretty sight. Synovial fluid is kind of like a barrier between that to make it move more well and it won't grate against each other like the two bones. And then we have something called the articular disc, which is a fibrocartilage pad between bones. And this allows tight fit between your bone and your intervertebral disc. And this is something like your meniscus or your intervertebral disc, which is this is your articular cartilage. It's at the end of the two bones, that blue thing you see right there. And up here, it's kind of like this whitish thing. It kind of covers the ends as we discussed in the structure of the long bone. Then we have ligaments, which are bundles of fibers that bind bone to bone, and tendons that they're basically also bundles of fibers that bind muscle to bone. So the main difference between ligaments and tendons are ligaments are bone to bone and tendons are muscle to bone. And we'll discuss this kind of more in next week's lesson, which is the muscular system. So here this is the whole synovial joint. That's what it looks like. And yeah, it really allows free movement because of how it's structured. And all of these things, the synovial fluid and the articular discs help it move around, unlike the other two joints I just talked about. There's also 3 functional classes of joints. We just discussed the 3 structural classes of joints, so like how they're structured, but these are the functions, like what it can do. So synarthrosis joints are the immovable joints. They're the fibrous joints that we discussed a few slides ago, and these are like the sutures of the skull. Amphiarthrosis is partially movable joint, which is the cartilaginous. And it's your, pubis, pelvis, and your kind of spine. And then you have your diarthrosis, which is your freely movable joint. So it's your knee, elbow, and shoulder. Just remember that these 3 terms are used to describe the function, like how much you can move it. And these 3 are the structural classifications. Like you're going to use these 3 terms to describe the structural. So how you would describe how it's structured. So bones held firmly by, fibers, connective tissue, bones held together by cartilage, bones united by surrounding articular capsule. It's how it's structured. It's the, structural. And we have different types of diarthrosis or free moving joints. First, we have the ball and socket joint. It's probably the most common one. And this allows free movement. It has rounded head and socket surfaces, such as like your shoulder and hip. You can kind of rotate your hips and your shoulder. And then we have the hinge joint, which is movement in a single plane, which it has convex and concave surfaces. So example is like your elbow, your knee, your ankle. If you hold up your elbow right now, you can only move it in, one direction. And it's kind of like a hinge, I think of as a door. So like if you're moving your elbow up and down, it's kind of like a door opening and closing, and same thing with your ankle and your knee. You can't like, it's a movement in a single plane. So it can't really like rotate very well. And then we have a pivot joint, which allows rotary movement, which is rotation. And it has rounded or pointed or ring surfaces. Example is like the atlas or axis of your neck. So basically the first 2 bones in your neck allow you to kind of move your head, roll your head back, rotation. Then we have gliding joints, and this is when bones slide and there's flat surfaces. So it's like pretty flat. Then an example is your wrist and your ankle. And then we have condyloid joints, which allow back and forth movement. And they have oval or concave surfaces. An example is like your hand And then we have a saddle joint, and it allows somewhat free movement, but you're kind of limited sometimes. And um, it's saddle fit surfaces. An example is your thumb joint. So if you kind of move your thumb, like you can move it pretty well, but like it's kind of hard to do like everything you want with it. And here in the picture, we kind of have, I just kind of have like some examples here. You can see the ball and socket joint kind of right here. It connects your femur to your pelvis. And I think of ball and socket, like there's always a ball, like a round shape on the bone that connects it to like a socket. So the round part directly fits into it's like a perfect fit kind of thing. Allows very free movement. Then we have the hinge right here, which is like the elbow. As you can see, it kind of looks like that, and that's what allows you to, you know, move your elbow up and down. Then we have your pivot joint up here, and it kind of allows you to rotate it. As you see by the arrows, it's located in your neck. And we have gliding next. I don't think it's listed here, but it's basically pretty similar to, I think, the plane joint. And you can see it kind of sliding in all directions. It's flat surfaces. And then we have the condyloid joint right here. Allows back and forth movement. The arrows kind of symbolize like how it can rotate and how it can turn. So it kind of turns both these directions. They're kind of ovalish, as you can see, concave surfaces. Then last we have the saddle joint, which kind of looks like kind of like a horse saddle, like if you can see it, like I can. And it kind of just it's like two of like the same structured joints kind of like connected to each other, if you can see. So like the top part is like kind of the identical to the bottom part, but then they like fit perfectly. That's located in your kind of wrist area. And some injuries and disorders to kind of your joints and your overall skeletal system. There's a lot. There are just some examples. So a sprain is partial ligament damage, and if you recall, a ligament is, you know, the fibers that connect bone to bone. So it's a partial damage. It's not super serious. Like if you ever heard anyone say, "I sprained my ankle," they're usually they might have to use crutches for a few days, but they're pretty much fine. A strain is more serious. It's an injury to your muscle or tendon. So it's like directly to your muscle. And then a rupture is even more serious. It's the complete tear of a ligament or tendon. So it's like completely, you know, dislocated. It's completely ripped apart from your other bone because it's what connects kind of bones and muscles together. It's completely teared off. It's a lot of recovery time for rupture. Then we have a luxation, which is the same thing as dislocation. It's just the displacement of bone from joint. So if your bone kind of falls out of the joint, for example, like ball and socket joint, if the ball kind of falls out of the socket, that's dislocation. It's pretty common. It's not actually super serious. Like once you go to, you know, your doctor and they set it for you, which means basically they put your bone back into the joint, you're pretty much fine. It's not super serious, but it is very painful. A subluxation is the partial displacement. So it's not all the way of bone from joint. So it might not be all the way out of the socket or like wherever it's attached, it's just partly. Separation is the displacement of your scapula from your clavicle. So it's very specific. Your scapula is your shoulder blade and your clavicle is your collarbone. So it's like separation is specifically those two bones being displaced. And chondritis is the inflammation of cartilage. So your cartilage actually gets infected or inflamed and it swells up. And bursitis is inflammation of the bursa sac, which is also kind of located near your joints. It's kind of like a sac. And yeah, that's it for today's class. If you have any questions, you can email me at this email. And I actually won't be seeing you next week. I have a conflict, but I will be recording the class myself, which is the muscular system. and I can put that on Classroom. So no live lesson next week, but I will be posting the slideshow, the recording, and additional resources. All right, thanks for coming.